Mr.
Yes, sir.
Dixon.
Yes, sir. Sorry for the delay. The drive up from Monterey was pretty packed, but you did meet Mr. William Ziegler, my senior veterans counselor. And
I got to meet him earlier.
Yes, sir.
Thank you, gentlemen, for your long trek. I know how far that is.
And as I was driving up here, I was thinking about what Junior was saying, is reaching out to people and put on this really short briefing for you, short and to the point. So good morning, Mr. Chair, members of the committee, and members of the association, my peers. It is important to understand our role as advocates in the community play a key part in assisting those in need of our services, and sometimes those who cannot help themselves. As you can see, what Sean was talking about, I do similar down in Monterey County. My name is George Dixon. I'm a disabled veteran, U.S. Army retired, and I am the County Veteran Service Officer for both Monterey County and San Benito County. I'm here today to talk about a special population of veterans who, without assistance from the County Veteran Service offices supported by additional one-time subvention funding, could not navigate the complicated paperwork obstacle of the Department of Veterans Affairs and Benefits Administration. The special population of veterans in Monterey County is our incarcerated veterans. Monterey County is home to Soledad State Prison and Salinas Valley Prison. At the present time, Soledad Prison operates a Veteran Service Office. This service office is operated by veterans who are incarcerated in the prison. The program was established by my predecessor, Mr. Richard Garza, who trained these veterans in veteran services, a basic working knowledge in the prison. They provide basic benefits and counseling to inmates in the facility. The program has been in effect since May of 2005. Mr. Garza still volunteers for Monterey County. Claims are processed through the Monterey County Veteran Service Office after they're screened by him. And I have documentation with the statistical data for Soledad Prison. Since the program's inception, incarcerated veterans apportioned benefits for dependents, which dependents from inmates received from that program with the help of our office, were $11,355,988.28. Incarcerated veterans retain monthly compensation, since some inmates are allowed to receive the 10% rate at $77,720.80. Incarcerated future felons in the amount of $1,413,271.82. And it goes on and on. I can leave these statistical data for you. And this is all done through the inmates and through our training them in the prison through our assistance. And there's also a list of where these veterans transfer to, because they do transfer throughout the facilities, San Quentin, Folsom, Chino, and they do get assistance from the Veteran Service Office still. And we still get calls. And also, with the one-time subvention, I was able to hire a part-time administrative person just to answer the volume of mail that he receives in the office. And right now, he's up to 87 veterans from all prisons across the state of California. Okay. We have made connection with Salinas Valley Prison. We are going in there, and then Sean has a program for the higher level prisons, but we're working together and coordinating services to those inmates, which in their entirety never actually sought services. And myself and William are going into that prison along with the VA at this time. Simple things such as helping those inside apportion benefits for their families, filing claims for compensation, help with the college tuition fee waiver. We can tell you great stories where there's an inmate of a World War II veteran that didn't know he was eligible to get a state college tuition fee waiver while he was in prison if Harnell College or the community college does that. Waivers for overpayments where, in turn, where the veteran will have a warrant and they'll be in prison for 25 years and there's a warrant going at the same time. So these are the complicated paperwork things that we do with these inmates. We had the opportunity to go in and talk to an inmate last week, myself and William, and the psychologist was with us. He said, just by you guys talking to that individual like a human, their whole demeanor changes. They're not inmates so-and-so and so. They then become veterans because we talk the same language. Other things that we do with these families of these veterans inside is we're helping their families on the outside receive apportionate funds from the veteran inside, which is very complicated because the veteran inside cannot navigate the system. It takes veterans service officers such as myself and Sean, Virginia, and Hannah to go in and talk to these individuals, get the paperwork, process it, and then do follow-up with it. Since August 2014, we have supported veteran service groups, meetings including a banquet celebrating Veterans Day. They have a veterans banquet, 25 inmates, and we went in and we ate lunch. It was very good. Right now, we're working on process on the other side to go through A through D yard in Salinas Valley Prison, but that's in the works right now, and we still continue to support the Veteran Service Office in Soledad Prison. We average about 6 to 8 veterans on each visit, depending on the situation of the yards. So if the yards are locked down, we can't see the veteran, but we don't say, okay, since the yard is locked down, we're not going in. We'll go in, and if the psychiatrist or psychologist escorts us to the yard, we'll go. And even to the term that they call the inmates bulldogs, where they're shackled, we will talk to those individuals. So
You're very courageous.
well,
I don't mean that in a trite kind of way, but I do understand one point that you make.
Yes, sir.
And that's the light bulb going off. Somebody cares, and there's hope. And that's one of the common elements when you're incarcerated. Nobody cares about you, and you don't have any hope.
In a term by an inmate, they think that they're castaway garbage from society. And the perception of some organizations, they will not talk to these individuals. But our organization has a no closed door approach. We have to talk to everybody. And it's our duty to help these individuals. And my duty as a county veteran service officer and as a veteran and as a military person is to take care of our own and to help those who cannot help themselves. Additional funding has allowed my office the flexibility providing services to these facilities, along with hiring part-time administrative support, which nobody's keyed on, because with our veterans VetPro system and automation and all the things we do, not only do we have to have county veteran service officers assist, we have to have the administrative support to upload, scan documents, review documents, make sure they're in the system correctly before we can send them to the Department of Veterans Affairs, because it's becoming all automated. We have to have the admin support to answer the letters or review the letters, and we respond back to these individuals, especially in facilities, because if you don't respond to them, you lost them. And they know when you go to visit them, and well, I sent you a letter to your office, and Sean can attest, if we don't respond, the minute we go back into the facility, well, I sent you a letter 3 weeks ago, and you're not helping me, and then they'll pass it around. But by having that proactive approach rather than that reactive approach, it works out a whole lot better. Subvention funds have also allowed Monterey and San Benito County Veteran Services to purchase equipment needed to support veteran services in the form of mobile printers and tablets to assist veterans in the field. So that means when myself and Sean go into the facility, we have access to the VA system. And they finally let me take mine in. So they asked me if it was a state computer, and I said the state bought it, and I have my Army bag and they let me take it in. So that's good. And it actually helps me, because the hardest thing with veterans incarcerated is, can they pick up a phone and call the VA? No, VA will not accept the collect calls. They get hold of our office, but by walking in and logging into the system, I can check on their claims. If we hold power of attorney on them, we enter them in VetPro. We can track how long the claims process goes in. A lot of things we can do with this automation. The tablets assist anywhere where the veteran stands. And I look at it as, I was Army infantry, no closed door approach, leave no veteran behind. And you have to do that, and you have to have the compassion, and we do. In closing, our ability to deliver services to our customers in the state of California depends on reaching out not only to those who are willing and able to navigate the Department of Veterans Affairs alone, but to those customers and constituents who may not be willing or able to get the help they need on their own, or were not informed about benefits at discharge. That brings up your World War II veterans. And I know a lot of these groups will go into nursing homes, such as we do in Monterey County, and talk to these World War II veterans. And believe it or not, I go to Carmel Valley. There's a nursing home down there that I have to go to, and no, Clint Eastwood's not in there, but I still go. I still have to go and visit it. And I have a call-in where a 97-year-old World War II veteran is looking for benefits and never applied, and that brings up a point.
97.
97. And some do physically walk into my office with their children. Providing assistance to those with a no closed door approach. By insisting the funds become permanent, will ensure that no constituent/veteran or family or dependent members will get left behind, as so many did during the Vietnam War. Help a veteran today, change a life forever. Thank you, sir.
Well, let me make a note of another challenge that we face, and I say we. We've long had problems with the inadequacy of in-custody treatment and rehabilitation. I won't get into it, but I'm sadly an expert in these matters, and I've always worked.
I have a list for you because a psychiatrist just emailed me. He knew I was coming here today. So.
I've got it. Well, for years we've been discharging from custody on parole tens of thousands, hundreds of thousands of unrehabilitated felons because they didn't get enough rehabilitative opportunities in custody, and that's a whole other story in itself. But then they go into the community. Now, pursuant to state policies, particularly AB 109, we're putting tens of thousands more in our community. It's the state doing a Pontius Pilate, washing the state's hands and dumping it on local government. Now, the problem with that, and I will always argue that rehabilitation is better done in the community, but the community resources were already vastly inadequate. And now when we've got over 40,000 out and you're dealing with them in the community, it's really a challenge. Now, that's one of the things that's always on my mind now as we're wrestling with the current realities of AB 109. But that is an impact on you, is it not?
Yes, sir. I'm glad you brought that up. Amongst the association, I know we were discussing, since myself and Sean deal with the prisons, and I know Los Angeles County does deal with the prisons down there also in the jails, about the transition of these inmates when they transition from the facility. And it would be a warm and fuzzy handoff. So say, for instance, somebody comes from Monterey County out of Soledad Prison, and Sean knows he's come to his county. They come to our office, hey, Sean, I got veteran so-and-so who's going to go to the halfway house in your area. And we all know what happens at the halfway house. Usually they go to the halfway house, the parole officer's supposed to help them. But 9 times out of 10, these individuals on their own. About a month later, they do something wrong, they're right back in. But by talking to these individuals, getting them in and giving them the warm handoff, saying, here you go, Sean, here's a veteran. And I call him up on the phone versus, oh, just go see Sean in his office. And Sean's not there, and then they come back and yell at you. But by handing him off, Sean has resources in his county. I might have initiated the claim in my county. Sean may follow up with the appeal and also get him his housing, his employment, and other things that he or she needs. And I bring up she because there's another population, the female incarcerated veterans. In Monterey County, I had 7 in my county jail, female. And that's where we need to look into too. But by talking to each other and collaborating, we were discussing how we can give the handoff to each county versus, oh, just go down to San Bernardino County and talk to Mr. So-and-so down there and they'll help you. And a way to track it, our system does do that if we set up the parameters.
Well, and that's a whole different dimension that you mentioned. I'm glad you brought up the women. And so many who got on that criminal path as a product of BWS, Battered Woman Syndrome. And that's another challenge. Senator Roth, please.
Thank you, Mr. Chair. First of all, thank you for what you do for the state of California and for our veteran population. I want to talk about mental health services, but I want to carve out the incarcerated veterans for the moment. That's a different issue slightly with respect to access to health care and mental health services that we're still grappling with. But for those who are not incarcerated or released from incarcerated conditions, what mental health, several of you mentioned mental health, so what mental health services available? Are the services adequate, and what obstacles to access are there that exist in California today? Sort of a 3-part question.
So if I could touch on that a little bit. So for instance, in Marin County, we have the Veterans Service Office, the Vet Center, which is part of the VA that was established by the Vietnam veterans to better help veterans suffering from PTSD due to either sexual trauma or combat-related PTSD. They will see any veteran who is discharged, who has been in combat or suffers from sexual trauma. We have that right inside our office in Marin County. We don't have, other than that, any VA medical services within our county. Everybody has to travel outside the county to get these services. However, by having that point person there from the VA, we're able to get them into the VA San Francisco, which uses UCSF to help support their mental health, or Palo Alto, which has access to Stanford to help them with their mental health. So we actually have in the Bay Area some of the best mental health within the VA system-wide.
What about county mental health services? Are there any county mental health services available through Prop 63? And
I'd like to address that question. That's a great question, especially for the rural counties. With the lack of VA services in our county, we rely heavily on county services as well as grant-funded and nonprofit services in our county. It takes a great deal of time to build those relationships and then keep up with the turnover and the moves and the changes. But when we are interviewing and assessing our veteran client, let's just say it might be a veteran who is low income or a single mother. They are not going to travel, in my case, nearly 2 hours to Mather Hospital for treatment. So I have to make an assessment with interviewing them. How likely is it that they will pursue that? Probably unlikely. So what kind of services can I get them? How urgent is this need? Do they need to be triaged? Then I'd make a personal phone call to somewhere that I could send them and know someone will be waiting to intercept them and help them there on the spot. We work with facilities that can see them once a week, facilities that can see them on a walk-in basis whenever they're having a personal crisis. We do that assessment there with them and then working with our community services. But our county mental health do pick up a lot of the slack that the VA is not able to do, either because of non-location of services, but also the VA is a process. And sometimes a veteran needs care, they need to be seen that day. Then they need to be seen the next day, especially if they're suicidal or homicidal. They can't wait 3 weeks for an appointment.
is it easy? Is that an easy process to navigate, or does it require personal intervention from you in order to make the system work for the veteran?
It takes personal intervention, knowledge, experience that we build over the years of being in our community.
Fortunate.
If I can expand on that one, my previous position, I was supervisor of Veteran Services, LA County, and I'm going to talk about Veteran Systems Navigator down in Los Angeles. And it incepted prior to me leaving, and what that does is County Mental Health partnered up with Military Veterans Affairs Office to assist those veterans in turn who have bad paper, who are homeless, and who cannot seek out services. So in turn, what the Veteran Service Officer does under Prop 63 and the one-time subvention is seek out and secure those homeless veterans or those families who are not eligible for VA health care. And mental health will take them in and do an intake and assess them and provide services. And our job as county veteran service officers was to then transition them out of the mental health or the state roles and put them back into VA mental health roles if they were eligible. But county mental health picked up the ball where the VA dropped it. In Monterey County, I am partnering with mental health there, getting that program established with those individuals. So in the rural areas, it's kind of hard because, like Hannah said, limited. And the VA says, okay, you need to travel 90 miles to the vet center. 9 times out of 10, if somebody's having an issue or suicidal, we're the first line of defense. So our job's not only vet reps, we're part social worker, psychiatrist, and attorney, underpaid attorney and overpaid paralegal, and a friend. And sometimes the trust that the veteran has mentally is with us.
And lastly, sir, I'd like to add that also in San Joaquin County, we also have the San Joaquin General Hospital as well as San Joaquin County Behavioral Health Services. And as my colleagues have stated, that is always almost the first line of defense. They first call us, then I contact my colleagues within the county, And then I pursue the VA healthcare, because most times, if they're not already enrolled in VA healthcare, it is almost impossible to get them mental health treatment right away. But I can get them treatment through the county behavioral health services. I work closely with, like I said, the general hospital, the behavioral health services to include substance abuse, as well as public health services as well, because sometimes their mental health condition stems from other physical conditions. So yes, we do have to establish those partnerships with our county behavioral health services before they can get into the VA services.
And also along with that, those lines, the nonprofit services too.
Well, thank you for what you all do. Thank you, Mr. Chair.
Well, I appreciate the reflections that we've got, kind of covering all the bases. Hannah, you more from the rural, you've got the urban covered here too. Ms. Winter, it is important because there are some kind of there are unique differences in the different scales of counties. I have coined a term over the years, suburbanizing counties. Solano is suburbanizing, meaning it's going from rural to being suburban. It's not quite there yet, but Contra Costa already made the transition a long time ago. But the point is, there are a little bit differences in these counties, and you're all giving us some reflections on that.